Okay.
Hello once again.
Our last video that we just filmed, we went a little bit.
We were a little bit all over the place. We're going to try to stay focused this time.
Not our strength.
No, but here's what we're going to talk about. We're going to talk about vaginal lubricants for intercourse. We're going to talk about vaginal moisturizers, not the vulva. This is inside stuff. And then hormones and the differences between all of those things.
Like a vaginal
hormone. Yeah. Okay. So let's start with lubricants for intercourse because they're kind of different. We recommend lubricants for intercourse for everyone, basically.
Yes.
Right? But if you are having discomfort, a water-based lubricant might not be for you. So everyone likes water-based lubricants because they sound like they're natural. But in Canada, the way that they are manufactured and regulated, they don't require to have a pH that matches vaginal flora and fauna. And their osmolality, or how many
salt.
How much you always use salt. Like how many other products are put into and mixed around in a water-based product. That's not regulated to the standard encouraged by the World Health Organization.
Isn't that crazy?
It's crazy. So a silicone-based lubricant, which sounds more sciencey and chemically, is actually better for sensitive skin. So if you notice that you feel itchy after using lubricants or after intercourse, you feel like you're getting UTIs, but you don't really get UTIs.
Burning
discomfort. Silicone is the way to go. It needs to go where you feel the burning and discomfort. So you have to open the labia and put it around the vaginal opening, not just
on the outside.
And then all the way down the length of whatever object is going inside. Both parts need to be lubricated. So we recommend a silicone-based lubricant, when we start talking about menopause symptoms.
And really, anyone who's had discomfort, dryness, again, we have a biased view because of the type of client and patient we see in clinic, but I would say 9 out of 10 people would benefit from a silicone-based lubricant.
Yeah.
I just want to come back for a second because you mentioned, I find that is something that when I say, okay, what are you using for lubrication? A lot of people will say the water-based lubricant.
Yeah.
And Katie's point about how many molecules are in it, if you have dry tissue and you're putting a water-based lubricant on that is not cognizant of osmolality, it can actually draw more water out of the tissue. Yeah. So it actually can worsen feelings of dryness.
It can increase the risk of fissures. And because of that, it can actually increase your risk of UTIs, vaginal yeast infections, vaginal bacterial infections, and sexually transmitted infections. Not because there's anything inherently different. It's just that when there's a fissure, there's a pathway for those germs and bugs to get in.
So Katie,
yes.
What if that's not cutting it and I'm still struggling with vaginal dryness?
So then we look at vaginal moisturizer. So a vaginal lubricant, a lubricant is for in the heat of the moment, right? A vaginal moisturizer is a product that you would apply weekly, depending, each product has a different kind of application method. So sometimes it's once a week, sometimes it's 3 times a week, it depends on the product. But that's more like using your facial moisturizer. Don't use your facial moisturizer. So products like Replens, Gynatrove, what am I forgetting?
There's another
one. Replens, Gynatrove.
We
like Gynatrove the most. Repagyne.
That's it.
Repagyne. So I tend to find that most people like Gynatrove. It has hyaluronic acid in it, which makes, it's what they use for joint lubrications. And it's what all the new facial moisturizers have. But they come in little applicators, kind of like tampon applicators, and they go up inside the vagina. And so it's something that you can discuss with your family doctor or your gynecologist if you think that might be the route for you. But that helps to improve tissues overall and not just for, acutely during intercourse. And then if that doesn't cut it, Eryn, what do we move on to?
Then you can talk to your doctor or your medical provider about possibly using a topical vaginal estrogen. Mm-hmm. So sometimes we'll talk, has anyone ever mentioned that to you when we're talking to a patient? And I find a lot of people, because of some of the research that came out in the late 80s, 90s.
There was one study in 2002, which was the big one that seemed to scare people.
Which was on systemic estrogen, so taken by mouth or transdermal patch. There's obviously an increased risk of breast cancer in particular found. And so a lot of people really got hesitant to use estrogen to manage symptoms related to...
Do you know what a gynecologist told me?
Tell me more.
She said that the increased risk in that study was equivalent to drinking 2 to 3 glasses of wine a week or being overweight.
That was the other crazy thing, was that it was actually not a hugely increased. It was like the risk was blown out of proportion based on what the findings in the.
So it is important if you've got a family history of breast cancer, or especially, or if you've had breast cancer yourself, especially if it's a hormone-dependent breast cancer, you need to go talk to your physician. So, like physiotherapists, we're not allowed to recommend and discuss pharmaceuticals with you. What we can do is provide the non-pharmaceutical options, and then say go discuss with someone if you're a candidate for estrogen. And there's lots of different options, especially within the last year or two. There's been so many new types of medications that can come out that are either kind of hormone mimicking or hormone replacement therapy. So make an appointment with your medical doctor, with your gynecologist, and have a discussion. But those symptoms are important, or those symptoms, so dryness, pain with intercourse, any of those symptoms that you're experiencing are worthwhile having a talk with your medical provider about. We went a whole minute over.
Also,
we're going to go even
just
farther
hydration, right? Especially if you're leaking. So many patients dehydrate themselves. Your skin needs water. It needs fluid. So just check in and make sure that you're actually well hydrated too.
That's it. We've gone way over now. I don't know. It's probably just our husbands watching at this point. Bye.